Now, this breakdown in trust or divide between the doctors and the nurses was also spoken about by another witness at the inquiry this week. This was a midwife called Annemarie Lawrence. She was appointed to the role of lead risk midwife in the Risk and Patient Safety Office in May 2016, which was just before Lucy Letby took up the admin role in her team. Now, although Ms. Lawrence was an experienced midwife in May 2016, she was new to patient safety, and the risk midwife role had actually been vacant for more than 3 months. And although another member of staff had been trying to do that job along with their own job, the department had been stretched for much of 2016. Ms. Lawrence actually said that the patient safety office at the Countess was one of the most under-resourced patient safety teams she'd ever known in her career in the NHS.
She said the fact that they'd been short-staffed went some way to explaining why her relationship with Dr. Breary was very difficult when she first started. He'd believed he'd been given little support from her department after coming to them with his concerns, and Miss Lawrence agreed he had a point and was right to feel let down. But she said she'd also encountered other difficulties with the unit from the off, and she described the relationship between the doctors and the nurses as far from equal. Nicholas de la Poor KC, another of the inquiry barristers, asked her about this.
I don't feel they had the autonomy or the confidence to challenge the consultants, and certainly it frustrated me at times because I wanted them to feel autonomous, to say, actually, from a nursing perspective, that's not appropriate, or we're not going to do that, or if we could just pause there and find out some more information. They were very much led by the doctors.
Did you witness for yourself any overbearing, authoritative, dictatorial behaviour from the doctors that might have created that, or was the extent of your observation the fact that the nurses weren't speaking up when you had hoped that they might?
I think a bit of both. Sometimes we would be in meetings where discussions were a bit fractious, and you could see tensions rise in that meeting, and you could... I don't quite know how to describe it really, other than the consultants would become just that little bit louder and the nurse voice would become that little bit lower, and they would contribute less into that meeting.
He also asked her about a comment that she made in her witness statement to the inquiry, where she described some of the consultants on the unit as more respectful than others.
You say there was definitely a hierarchy and some consultants were more respectful than others. Which were the respectful consultants and which were the non-respectful or less respectful consultants?
Do you really want me to answer that?
I wouldn't have asked it if I didn't.
Okay, so some of our more respectful consultants were our female consultants, Mr. John Gibbs.
You said Dr. Gibbs. Does he fall in the respectful category?
Respectful, absolutely.
Yes.
And all of the female consultants.
So Dr. Newby initially, although I don't think she overlapped with you, Dr. Holt, who joined in March of 2016, Dr. ZA and Dr. V.
That's correct,
Yes.
Some of our less respectful consultants were definitely Mr. Breary and Mr. Jayaram.
She also said that in 2016, all staff, that's the nurses, doctors, consultants and managers who worked on the unit, were not open or transparent about reporting clinical incidents, and some even made deliberate and cynical decisions not to do so without conferring with their colleagues first. She said the consultants all stuck together and they viewed incident reporting as punitive.
She was then asked about the thematic review into the baby's deaths, which was carried out by a neonatologist from Liverpool Women's Hospital. Now, that review was completed in February 2016, and a report, which also included Mrs. Powell's infamous staffing chart, was emailed to her boss, Ruth Millward, and her deputy, Janet McMahon, at the beginning of March. And we're going to delve a little bit into the detail here, just to tell you a bit more about June the 24th. That's the day that baby P died. We had heard a lot in the criminal trial about the efforts of the doctors and the nurses on the unit that day to try to stabilise and resuscitate him when he collapsed, and how upset they were when he died.